Okay. Sorry. Now start again, Natalie.
Okay, perfect. I am calling to order the Formulary Council of the Oregon Board of Naturopathic Medicine on March 18th. We'll start with a roll call. And would you like to start, Megan?
Megan Larrabee, ND, Oregon Board of Naturopathic Medicine member.
Perfect. And how about you, Adam?
It's Adam Olani, formerly council member.
Great. And since she's driving, I don't know if Stephanie Culver can speak up, but she's also attending. And then Natalie
I'm
Gastick.
here.
Oh, yay. Hi. I
Stephanie
wasn't
Culver.
sure. Wasn't sure how easy it would be.
Sure. Stephanie Culver, ND, Formulary Council member. Present.
Great. I'm Natalie Gustafson, chair. And then we'd like to welcome Dr. Hicks. Hello.
I think we can't hear
I
you.
believe I'm
Oh,
not, I am an ND, but I believe I'm in a different role on the Formula Council. And Mary Beth, maybe you can remind me what the title of that.
the advanced degree member.
Okay, gotcha.
Great. And then John, would you like to go?
You're on mute.
Now you can hear me?
Yeah.
Okay. My name is John Myers, Farm D. I'm a new member from the pharmacist community, advanced degree in the Farm D.
Yes, you and Natalie are pharmacist members.
Okay.
Great. All right. So welcome to both John and Matthew. Thank you for joining us. We're excited to have you on the council. We're definitely excited to hear like your input on different things, and I know we've all been very curious about some of the changes happening, especially with like the psilocybin regulations. So we're excited to kind of go over that and know what we're looking at with all of that. Before we get into all that, though, I know we need to review some of the applications for the council vacancy.
Right.
And so I know it sounds like we didn't have any new applicants from the last time.
Right. But just for a brief second, Natalie, I know we all looked at Dr. Hicks's application, but I thought maybe he could just say a couple words about himself before
Great.
and John, you
Dive in.
already had that chance, right? Last time?
Yes, I
Okay.
did.
All right. So maybe Dr. Hicks can just.
Perfect.
Sure. So, in addition to a naturopathic doctorate degree, which I earned in 2018, I also have a master's in clinical research from UNM. I'm also currently the chair of the Psilocybin Advisory Board in Oregon and was recently made a fellow of the Oh, see, I always get the words mixed up, but it's the American Board of Naturopathic Psychiatry or something like that. And yeah, I'm adjunct faculty at UNM and actively engaged in research and also the founder of a naturopathic clinic specializing in ketamine assisted therapy.
So you have a lot of spare time.
Yeah, yeah, and loads for sure.
Awesome.
Nice. Sorry, I skipped that. Thank you.
That's okay.
Yeah.
You're just getting down to business.
No, it's totally fair. I forget because we were on a subcommittee together for
Oh, right.
this, for the ketamine, and so I so sorry about that. Yes, thank you. Welcome. All right. So, for the council vacancy, so we are basically looking at the position that would be the advanced degree in medical or pharmaceutical science. And this is where, just for a little background, we've run into some snags in that we are lacking applicants that are in more of the traditional degrees that we've been looking for this position. So we're having to expand a little bit and take into consideration people who are also naturopathic physicians, which is an advanced degree. But as we discussed previously, the kind of goal of this was to expand beyond just a council of NDs, just to get like outside opinions and different goals for that. And is this to replace Adam? Is that correct?
Yeah, we're hanging on to Adam
Yes.
at least 3 meetings too long, so
Yes.
we gotta.
Actually, I passed it around, but I haven't get any good response
Yeah, yeah,
Yeah.
from the college, you know.
Yeah.
The,
And
the
we
problem
appreciate,
the problem with the situation right now in the college, all of the faculty member are senior. We don't have a new faculty, and everyone is loaded. Therefore, it's
yeah,
like tell them another service. And no, no, no.
right.
so fair. Yeah, we appreciate you staying on and we appreciate you like asking around for that for sure. So the thing that we have to kind of consider is we do have applicants from the pool we had last time, all of whom are NDs, but some of them do hold other degrees as well. So we do have to kind of decide, do we want someone with a dual degree? Do we want someone who is just an ND? Like who seems most qualified for the position? I know Mary Beth had asked us to kind of review the applications and think about who might be some top applicants out of the pool. One of the things that I did when I reviewed is I did look to see who had other degrees, like or dual degrees. And so the two, well, there's three that do. So there is Gutierrez, who is a RPH, so was a pharmacist and is now an ND. And then Fitzpatrick, who was a RN and is now an ND. And then there's Sadowski, who is an ND with an MS. But I had a note to myself that he might live out of state.
He lives in Vermont.
Yeah.
He
So I
works
think
at an FQHC out there.
so I believe that rules him ineligible. So I think that means if we do want someone with dual degree, we have two options out of that. And that doesn't mean we have to do somebody with a dual degree. I just wanted to review like that aspect to it, just in case that was a factor for people. So I don't know if we want to just open up like a round robin maybe to discuss like top, two or three kind of options out for each person. Does that seem reasonable? Great. Would anyone like to start? I can start if you want, or someone else can. Okay.
Hands down, Natalie.
You want, okay. So I probably looking at just like the principle of this, and wanting like outside opinions and different things, I would probably vote for Gutierrez as my top, because of her pharmacist background. And then she also did some of the like pharmacist prescribing before she became an ND. So she has like a pretty broad knowledge of both medicine and prescribing, and also that shift between, and she has a viewpoint of both from the pharmacist side and from the ND side. So I think she could provide a lot of like good input, and have a balanced view for that because she's seen both sides of it, both before she became an ND and then after. So I think that would probably be my top choice, just because of her exposure with like medication and since we were a formulary council. So that would be my top choice, but I'm definitely open. We have a lot of very qualified people who applied. So I think in the spirit of trying to get someone who isn't solely an ND, I would probably vote for either her or potentially Fitzpatrick, who has also been a nurse previously, just again for a dual perspective on that.
And Natalie, why don't you say a couple words about Fitz, your thoughts on Fitzpatrick before we have everybody go around too, since yeah.
Yeah, I think Fitzpatrick has been in like practicing for a long time, which is good also. So like a lot of experience. I believe, if I remember right, like I think 20 years was a nurse before switching. Am I remembering the application correctly with that? Hopefully. Um, but I definitely think like the mixture of background on that could be like helpful for sure. And also just a long time in the field. Gutierrez has also been in the field for quite a while too. So both have a pretty decent amount of experience walking into this. I know we discussed like Dr. Fuller last time too. She doesn't have another degree, but she also has taught a lot and like been involved in a lot of different practices and things like that too. So it kind of just depends on what direction you all want to go from with this, if that makes sense. Oh, you're
So
muted now, Mary Beth. Sorry.
My cats are being crazy. That's why I muted myself. But it looks like she had her pre-med was in developmental cell biology as well.
Yeah. Yeah, so she's got a pretty good background, for sure.
And just because Natalie had those as her top two, if anybody
Oh,
has a
yeah.
different setup, but I just figured it was easier for if we all pick the t one or two or three, see if there's any consensus and we could kind of focus the conversation on that. So
Oh, yeah, and I'm not trying to influence anyone on this
no,
either. Yeah.
well, you can have an opinion.
Yeah, I'm just
That's
giving my
allowed.
opinion. Yeah, fair.
So yes.
for me, as I agree with the Gutierrez, I think if I'm going to be out, which is background pharmaceutics and formulation, and as understood, also Natalie will be her. Maybe she's not going to be with the council for a long time. That's meaning it would be a nice addition, someone with a background in pharmacy or pharmaceutics to be added to the Formulary Council. And especially, I think with Gutierrez, she has the both background in the medicine itself as well as in the pharmacy. That would be she's going to be more invested and also will give both perspective to the council. Therefore, she's my first choice.
I agree. I Gutierrez is my first choice as well. I like that she has the pharmacy experience.
Same. That was my opinion too.
Also my opinion.
Same.
Great. I mean, that makes it pretty easy. Okay, so I think to vote for her, we need someone to propose it and then someone to second, right? And then we'll do a vote. So I can propose that we appoint Kimberly Gutierrez for the formulary position for the advanced degree in medical or pharmaceutical science. Does anyone second that?
I'll second that.
Great. And then we'll
Any discussion?
any discussion? I feel like we all voted.
Well, no, you didn't vote yet. You're
Oh,
voting
yes.
now.
Now we have to because yes, that's right. Any discussion before we do our vote? Okay, great. Let's go through. Megan, are you a yay or nay?
Oh, I'm a yay. No
Yeah.
discussion.
Yep.
Oh, do we all vote? Okay. I'm a yay.
Can we do it all at once or do we need to go?
You
Okay,
can
we
say all for any opposed.
okay. All four. Aye. Yep.
I
Yep. And then any opposed? Nope. Okay, great. And then Matthew, you had oh wait, are your hands up for yay or
Sorry,
question?
that was an automatic Zoom thing that just
Great.
recognized my hand was up and did that.
Oh, that's
But
wild.
Oh, oh, that's interesting. I didn't know it did that.
Hey,
Huh.
you got yours too, Adam.
you
Okay,
can
that's
disable it, but it's yeah, it did that auto.
that's
Oh.
cool.
Huh.
So since that went kind of speedy, and I know Dr. Hicks, you're gonna be up next, and I don't want to take a whole lot of time, but I am thinking of, and this is news to you, Megan, but I'll talk about it more in April. I'm thinking of introducing a legislative concept to kind of fix this formulary council's way makeup and definitely the term limits because if you're only 2 years and there's two meetings a year, we're constantly looking for people, and that's not sustainable. So I'm definitely gonna see if we can put it for 4 years since it's two meetings a year. That seems like a normal amount of time to change it. But I also think that this advanced degree thing isn't really clear, and we keep getting NDs, which we can't say no to because they have, sorry, because they have an advanced medical degree. And also the way that it's written, I think one of the words is farcical, right? Like it's not even a thing. What are the definitions of what like pseudo something or other science, like it's not even a real thing. Um, and so I'm just wondering if anyone has suggestions. Like Adam, I would really appreciate it, because you're the last one that's actually exactly what it was supposed to be. And so I'm just curious how you think like what the benefit is to having someone with an advanced science degree that's not a pharmacist, that's not a doctor, right? Medical doctor or a naturopathic doctor. Like how should I frame this position? Like what is it that the value, you know what I'm saying? You're on mute.
Yeah, I think it's at the beginning of my appointment, we had a lot of conversation about formulation, which is I think that was very valuable because the perspective come from two point of view. Um, um, if you are talking about formulation, you need a formulation scientist to say this is a reasonable approach or no. But uh, honestly, right now, I don't think it's really you need a PhD in formulation scientist. If you can have a person with a background like Natalie with a compounding pharmacy would be sufficient. But over the last 2, 3 years, the conversation was less about the technical aspect of anything we are, any product, and was more about practice and the laws and the guidelines for any product that we're discussing. Therefore, I don't know where we're gonna go and the board how they're gonna go, but I think based on my experience, the science itself, I don't think you need a PhD right
Okay.
now to fulfill this my position. A formulation, if you have a compounding pharmacist, that would be more than efficient and sufficient.
Anyone else have any? I mean, I know John and Matthew, like, do you go by
Yeah,
Matthew or Matt? Is it
Matthew.
Matthew? Okay, all right. I
Yeah,
didn't think it was, I didn't think it was Matt, but I just wanted to make sure I wasn't like acting like your principal or fifth grade teacher. Okay.
yeah, my thought was just to have certain positions specifically state that they're not indies. So we
Mm,
have spots for indies on there, but for the ones that are other advanced degrees, just in that description specifically say not ND because I mean, that's who mostly gets these announcements, right? Is like, we're looking
right,
for, you're advertising among indies, so you're likely to get them. And I know when I was reading these descriptions very recently, I was a little bit confused. Like, am I eligible for this? Am I
right.
applying for an indie position or not? Like, I sort of just like, I'll just apply and see what happens. That's kind of my
Right.
attitude. But if the description said specifically, we need someone who's not an ND, it's like, okay, then that would make it more clear.
So I'm also thinking that, and I know we're having trouble getting medical board, but I'm also wondering what your thoughts are of like having a nurse or, like another profession besides, but I guess what you're saying, like we do have a nurse as the advanced degree, right? Like that if it's an advanced degree nurse, right? But I'm trying to figure out how, like, what would be relevant. And I know you're right because I send it out, but I sent that out to the pharmacy board and to the medical board. Like I sent it out to, I think I even put it on my personal Facebook page. Like I was like, so anybody, please apply. Um, I'm just trying to figure out, like, I totally agree with you. Not ND should be said, like, is part of that, right? I think that would make it the clearest. But with that said, what kind of, I mean, the way this council is evolving, it's more kind of like in your direction, Dr. Hicks, right? Like it's the new kind of more experimental therapies that, they're not even really on the formulary, right? Like ketamine's not on the formulary, right? So I'm just trying to figure out like who would be the best target as we're moving forward. Because I think you're right, Adam. It's not about the dosing or the science behind it anymore, right? It's
No, no.
and then when it is, we do have our two pharmacist board members who are, appointed by the pharmacy board. So I guess I'm trying to think of a way that it's not so rigid, right? To have this kind of, you must have an advanced medical degree. Um, and it's not all NDs, which I think really Dr. Hicks putting it simply, not ND is perfect. um, but just what else? Oh, John.
Yeah, part of it is optics. Part of it is to have other folks other than
Right,
NDs, because you don't want to say, oh well, they're just NDs. They can do anything they want,
right.
because they'll get pressure from the group. And consider that many of these types of boards have a public member. They
Yeah, I
have
was thinking the
nada to
public.
do with the specifics, but and the nurse might be something that has value, because she's got probably a more of a concept of patient care and
Mhm.
patients' needs and wants, and the kind of things that keep them from doing what we tell them to do, because they have something about their interaction that's not believable or whatever. I mean, just the fact that they have a point of view also, besides the
Yeah.
fact that what the law says and what we know what they should do. Yeah.
And I was also thinking, on that same vein, John, about like the nurses having the patient care. I was also thinking about people who like do substance abuse disorder, right? Like,
Right.
I don't know. I'm just trying to figure out like the direction or psychologists, right? Because Dr. Hicks, you're doing a lot of work, in that field too. So I guess I'm just trying to figure out how to unpack the very sciency position because it just doesn't seem quite as necessary, but also making sure we have that divergent view. My only concern of a public member in this situation is that you're an advisory board to the board, and so the board makes the ultimate
Mhm.
decisions on things, especially when I rewrite the rule because the rule is really weird, or the statute, because the statute's really weird that the board votes on it, but they have to do what you say. Like that's incongruous, right? Like that's you can't have that boomerang. But it is an advisory body to the board, so I do kind of need expert opinions, and the board
Okay.
has the public members to have that discussion.
Okay. Okay.
But I did think about a public member too, but then I was like, well, no, that's not kind of the right fit.
Yeah.
So,
Okay.
um, so Stephanie, do you have any thoughts?
I liked your idea about the advanced practice providers. I'm thinking like physician assistant or nurse practitioner, psychiatric nurse practitioner. I mean, there's so many advanced nursing degrees beyond RN.
What is it called? Advanced practice providers?
Yeah, APPs.
And that's like a real, I mean, sorry,
Yeah,
I'm not.
no, it's a term used to kind of group non-MDs, DOs, like in hospital settings or in big uh, healthcare settings. So, like for example, OHSU APPs just went through a huge contract negotiating thing. And so it was all of their nurse practitioners, PAs, um, fellows, things like that, residents.
That would
Um,
be, I love that there's an actual, because the other thing about this advanced degree is like, I have an advanced degree, I mean, like, so
right.
it's like an advanced degree is so amorphous and it's hard to,
Yeah. And you
so I
could
love
really
the idea of
specify
it
like advanced
being,
practice provider. They're called physician associates now in Oregon, not physician assistants. So physician associate, um, FNP, DNP, or DN.
so there's a set group of professions that are considered advanced
APP.
practice providers.
Yes. Yeah.
Oh, I like that.
And they're a step above an RN.
Okay.
They can make diagnoses. Sorry, my dogs are making noise. They can make diagnoses, they can treat, whereas RNs aren't able to make diagnoses, but they can carry out the treatment, but they can't decide the treatment. Um, I
I
mean,
like that. Does
love
everybody like that?
Yeah.
I like that. Because
trying to
this
think of
this
like
yeah,
doctors of podiatry are another APP. Um,
do they Well, you said they're able to prescribe, yes?
Podiatrists?
No,
Mhm.
no, APPs.
Yes, yeah. They're able to diagnose and prescribe.
I like that.
Yeah.
And I would like somebody in a hospital setting, right? Like for some reason to, I don't know.
At least an FQHC or something that's
Okay, use words
to
because
high
I don't know there.
volume.
What's HQFC?
Federally qualified healthcare center. They usually deal with high volume,
Okay,
lots of meds.
lots of
Work
meds.
at a FQHC.
And would people who like because I really do like so Dr. Hicks, you said you're on the ND psychology. What did you just say you were on the board of?
The Oregon Psilocybin Advisory Board.
And then something about the naturopathic
Yeah, so there's
psych
a new, well, recently, in recent few years, the American Board of Naturopathic Psychiatry. So familiar with like the Oncology Association of Naturopathic
yeah.
Physicians, it's very similar to that, but for psychiatry.
Yeah, because I don't want it to be NDs, but I'm also thinking like psychiatry would be, psychiatry or because they're doing a lot of work in this, the psilocybin and the ketamine and what's the other one they're doing?
MDMA.
Yes,
Yeah.
thank you. So, I mean, I think a psychologist would also be, I think, and then there are also people who are doing substance use disorder, right? Psychiatrists,
Yeah.
psychologists, yeah.
Yeah.
So I like the advanced degree, and then I like the idea of um, psychology background too, because I feel like that's where medication is going, and that's where the practice of naturopathic medicine is going. Um,
And just to be more specific, psychiatry, which is different than psychology.
right, sorry, you're
Psychology
right.
is like therapists, but psychiatry will have expertise in psychopharmacology.
Right, because psychologists cannot prescribe.
Right.
Got it. I was
And then-
using those words interchangeably when I shouldn't have. Thank you for
And there
correcting.
are APPs, psychiatric nurse practitioners.
Yeah.
Oh,
So they work alongside psychiatrists as well. And they're very knowledgeable in psychiatric medications because they also diagnose and treat.
well, I really like this APP thing. I think that will be really helpful.
It'll at least open up the pool a little bit.
Yeah. And it seems like there's a lot of them.
Yeah.
Right.
Oh yeah.
Just question, that's mean, are we gonna say no NDMDs? Or for example,
Well, I think
dual degree with NDMD with
yeah, I think
other
I'll put I'm gonna have to massage the language, but I think I'll put like advanced practice practitioner, advanced practice providers, um and maybe somehow interweave psych now I can't say the word. Psychiatrists, maybe. In there.
A psychiatrist would meet your MD requirement because psychiatrists are
Okay, so then we won't do that.
just so you know, like you
Thank
can,
you.
but you can meet that requirement under the MD.
MDs, right? Okay, but they have a separate board.
Mhm.
They're just under the general medical board.
Oh, they are?
Mhm.
Yeah.
Oh, Lord.
It's like a specialty, right?
Yes,
Mhm.
exactly.
Yeah.
Yeah.
Okay. So maybe I am totally conflating because I know psychology has their own board. Okay. So MDs will take care of the psychiatrist part. So I really like this advanced practice provider idea. And then I can just put, I think it's a great straightforward suggestion to put, non-ND positions, right? Non-ND position, advanced, right? Non-ND position, right? So because you could even have an ND-MD, right? And so we have to make sure. Um, so I think it's easy just to say, like, just straightforward, non-ND position, non-MD position, advanced. Yeah, I like this.
Yeah.
I like this a lot.
It's
Does
in
everybody like this?
It's in line with the Formulary Council for the Oregon Board of Pharmacy too, right? Because they have two advanced practice nurse positions, two MD positions, and then three pharmacist positions. So the advanced practice part, and I know with them narrowing it to just nurse has made it hard for them to fill that position. So I think having it be more open to the advanced practice providers, like wider than just nursing, I think it's great because that should help with some of the issues they've had.
Yeah, that's awesome. I think that this is perfect. I'm very happy. Does everybody think, or does anybody else have any other ideas? I love
Now,
the combination.
the
Yeah.
other advantage is that somebody that associates themselves as an APP wouldn't do that if they were an MD or an ND because that's
Right.
a more advanced. So if you can focus on that community, say I'm sure you've got a great mailing list now that's available just from the boards.
Yeah.
Yeah, that should be good.
Yeah.
Yeah. I just wanted it to be something that's like an actual job, right? Like, not that Adam, it's not an actual job. That's not what I meant. What I meant was I can say like a pharmacist, like for the pharmacy board pharmacists, like we know who we're recruiting, right? Like,
Yeah.
right? The NDs, we know who we're recruiting, right? Like like to have a position description is what I meant, not an actual job. I'm so glad I'm recording this to put it on the website. I've just offended, I'm the Timothy Chalamet of board directors now. So um I think that's awesome. I'm so glad I brought this up. It was like really frustrating me and we just had this meeting yesterday calling for legislative concepts that don't cost anything. And I'm like, oh, this won't cost anything. It'll actually be more efficient. And so it's kind of fitting in that window. And I just the statute is just so horribly read that written that I was just like, okay, we have to fix this. So awesome. Thank you. Now it's 5 minutes over where I wanted to be, but I think this was really valuable. I really appreciate that. Okay. Dr. Hicks, on that note, would you like to, I was like, I got a message that said to President, yes. Would you like to give us an update on psilocybin regulation?
Sure. So I have these some slides to help a little bit here. These are not my slides, and so they're intended for a different presentation, but I thought they were helpful. I'll just skip a few here as we go along. Some of these are from the Healing Advocacy Fund, is the organization that put some of this together. They're an advocacy group for psychedelic therapy. And anyway, so to give you a little bit of background or reminders, if you're not familiar with the program, is in 2020 we voted on Measure 109, which created the Oregon Psilocybin Services Act, which is now in the law as ORS 475A. And that included a 2-year development period. So that was basically all of 21 and 22. And then, let's see, in January, well, there's a timeline coming up here. It kind of took effect and started offering services. But everything about this program falls under the Oregon Health Authority. So it's a division of OHA. And what it essentially does is creates several license types. So you have facilitators that have to go through a program approved training program to get their facilitator license. Then you have the service centers, which are the locations where the actual psilocybin administration has to happen there. They can only happen there, and they cannot be co-located at a healthcare facility. So clinics cannot get accredited to do this currently. That's actually a rule I am advocating for change because I think it's kind of arbitrary and silly. But anyway, that's currently the status of it. So they have to be separate. And then there's a license for basically growing the mushrooms. They call it manufacturing, but they're growing one species of psilocybin mushrooms known as Psilocybe cubensis. And then there is a license as a lab. There's only one lab in the state currently who holds this license. So all the manufacturers have to send a sample from every batch they grow to this lab, which then gives them the data, which has to be on the label of the product that tells them the concentration of the psilocybin and the psilocin. Those are the active ingredients for that batch, and then the dosing is based on the concentration rather than the weight of the whole mushroom. So, some other factors around it is that to participate in the program, someone does not require a diagnosis. There's no prescription. This is considered an adult use program, so they don't use the word therapy. They call it services. And so anyone can work with a facilitator to do this. They just have to be 21 years of age. And the exclusions are that no one who has taken lithium in the past 30 days can do it. If they have any active suicidal ideations or thoughts of harm or any active psychosis, those are the mandated exclusionary causes. And then, facilitators can choose not to work with people if they don't think it's advisable for a whole host of reasons. And there's a whole bunch of forms that they have to fill out. This is OHA's solution is just create PDFs that have to be filled out. So it's a very kind of cheap solution that is kind of a headache at times. But they have to fill out a lot of information there. Yeah, Stephanie.
Where do you find those forms?
Yeah, so this is a screenshot of the web page. So Oregon Health Authority has a whole like sub page for Oregon psilocybin services, and so it's a government website. It's not super easy to navigate, but if you like spend enough time, you can, or actually just search for on Google like client forms for psilocybin services. It'll lead you to this page ultimately. So, one other thing to just clarify is that there's no retail sales. That was like a big deal, an area of confusion, because a lot of people just hear, oh, mushrooms are legal now, and they compare it to cannabis. And so they're imagining, dispensaries, and that's not at all how this program works. So there's no off-site consumption of psilocybin. It has to be with a facilitator present at one of these licensed service centers. So here's the timeline slide. It passed in 2020. There was the 2-year development period. In January of 23, services finally opened up and started offering thing. And then what I'll spend most of the time chatting about here, which won't take very long, is these few updates that have happened. Senate Bill 303 and House Bill 2387, which passed recently. So I'll get into those in just a second. But one other thing to mention is that what the law also mandates is a minimum of one preparation session. Most facilitators do 2 or 3 often, but at least one where they go over all the forms that have been filled out and prepare the client for the experience and do all the screening and stuff. And then there's the administration session itself that happens at the service center. And then by law, they're required to at least offer one integration session, or what's called integration session. Clients are not required to participate. Most do, of course, and sometimes they do multiple sessions. But these integration sessions are just an opportunity for the facilitators and the clients to sort of talk about what happened, process it. And so it's kind of therapy-like. Okay, so there are currently 23 licensed service centers across the state. There's over 390 licensed facilitators. And since May of 2023, when they started collecting the data, over 18,000 people have participated in this program, and a very low rate of severe adverse events, 0.3%, 0.3%. So it's been by and large a pretty safe program. Senate Bill 303. So what Senate Bill 303 did was mandated that the service centers collect certain demographic data. And one of the big issues in psychedelic therapy is that a lot of people are still very paranoid about their data, even more so than general healthcare data that gets collected, because it's a Schedule 1 substance and people are worried about, well, if somebody at work finds out. The most paranoid are medical professionals who are afraid of a board thinking that they're druggies or something. And so there's just a heightened awareness around that. And so what they have done is, and this is just a pet peeve as a researcher, is they've made the data almost useless because it has to be reported in aggregate, meaning a service center says this month we saw, 502 women and 437 men. And, this many Hispanics and that many Black and this many white and so on and so forth. But it's impossible to tell how many Black women or white men versus other demographics and related to other data. So you only have these sort of raw numbers, and they report it quarterly. So not useless information, but difficult to draw a lot of conclusions or do any research on it. But it's there and it's publicly available on the data dashboard, again, at the Oregon Psilocybin Services website. You can go and they publish that quarterly. So let's see. Talked about this a bit already. Um, there's some slides in here about Colorado and New Mexico. Colorado has a similar program, but it's quite different. It just launched kind of more recently in January of 25. New Mexico has a bill that has passed and is in development, will launch in 27. So I won't go into how those are same or different, but they're happening. So other states are kind of following suit, learning from some of Oregon's mistakes and snafus and improving upon them. So let me just kind of skip through some of these slides. Okay, so one of the issues that was facing practitioners here in Oregon was the law had previously said that uh, facilitators could not, if facilitators had another scope of practice, so if they were naturopaths, if they were psychotherapists, if they were anything else, they could not be anything other than a facilitator during the whole process of preparation, integration, and the administration sessions. And that became kind of silly. So if you can imagine as a naturopath, if someone came to me and wanted to do this process and this is a preparation visit and they said, oh, I'm on this medication and that medication, I run the risk of violating my scope of practice to give them advice on that. And so this was a cumbersome issue. We would have to schedule separate visits or just kind of not follow the rules and share what we knew anyway. And so that one needed to be fixed, and it also was a financial barrier issue because these services are very expensive and there's no health insurance coverage. So that was one of the issues that they took up in what became known as House Bill 2387. This was signed into law in last May, so almost a year ago, and is now in effect. And what it did was create some provisions for dual licensed practice. So for those who have other scopes of practice, they can now use those scope of practice for preparation and integration, but not the administration sessions. So when they are actually ingesting that session, when they're actually ingesting the psilocybin, they are only a facilitator during that session. That's just an important caveat to note. And it also created, it did a couple of other things that I may not go into unless you have questions about it. But it also created protection for those dual license practitioners from their other boards. And so there's a list here of those other boards. But what it does is protects their right to discuss psilocybin without fear of reprisal. So if someone was a licensed facilitator and a medical doctor, the medical doctors are always the most paranoid about all this stuff. But their medical board could now, within Oregon, not say that they're not allowed to talk about psilocybin or refer to psilocybin services. That is protected now under law. So they can do that. But again, in regard to preparation and integration sessions. So here's the list of boards. It includes the Oregon Board of Naturopathic Medicine and several other professions and more. Was a recent bill that wasn't directly about this. It was about well, it was about the occupational and physical therapy boards, which added themselves to this list. So that is more recent. So I think that's pretty much it. I already described this, and I think that's pretty much what I had to share on the topic, but I'm happy to answer any questions about those updates, or anything else. What I can say about the other part of the House Bill 2387, what it did in terms of labeling is it required the manufacturers to label the psilocin content. So, um, psilocin is the active constituent. So psilocybin, once it's ingested, is dephosphorylated, and that the psilocin is then what binds with the serotonin receptors to be the active constituent. And so that was previously, most of the manufacturers were putting that on the label, but they were doing it voluntarily. So now that was codified into the law. They have to label it. So because the mushrooms will contain a certain ratio of psilocybin and psilocin in there, and so if they had really high psilocin content, but only the psilocybin was labeled, you have potentially a much more potent mushroom compared to another strain or another batch that where the ratio is different. So that has to be on the label now, and the board is also considering adjusting some of the requirements to just have a this hasn't taken effect yet. This is just a point of discussion, but in changing it to total psilocybin equivalence, so it just sort of combines the two. But anyway, that's kind of coming down the pipeline potentially. But happy to take any questions anybody has.
How much do you think NDs are going to integrate this into their practice more now that they are like more free? Do you think that will help get more facilitators and things? Because like I imagine that was pretty tricky to have to separate that out before.
Yeah, it was kind of a headache. Most of the headache was just explaining it and making it clear to clients, because it's like in today's visit, I'm a naturopath, and in these other visits, I'm going to be a facilitator. And now we don't have to I mean, we still have to explain that for the sake of the administration sessions, but it's not generally really necessary. There's not a whole lot we would do as naturopaths during an administration session that we can't do as facilitators. So it removed a slight barrier and removed some confusion, but it didn't necessarily change a ton. So I don't know that it's going to change who would become a facilitator or not. There are, and I have no idea what the numbers are. I know of about a dozen or so naturopaths in the state who are dual licensed. There's maybe a few dozen that I don't know, but it's not a huge group. But yeah, you'll have some people who are very interested, and it sort of aligns a lot with kind of naturopathic philosophy and kind of healing from the inside out and these experiences. So a lot of naturopaths are drawn to it, but the trainings are very expensive, and it does require some specialization and dedication to this practice, and so not everyone's gonna just add it as like some little tack on protocol that you can learn about at a conference. It's a heavier lift than that, so it'll remain some small fraction.
For sure. With the cost, are patients usually only, well, I guess they're not considered patients, are participants usually only able to do one session, or are they able to do more than one? Because I know, like, for instance, with like the ketamine assisted, you do multiple sessions. So I was curious, like, how this compares to that work with that.
Yeah. So there's one of the other advantages of being able to do the preparation and integration under your scope of practice is you can bill insurance now for those. So I can bill a medical visit code or a psychotherapy code for
Right.
those sessions. So that can help lower the cost a little bit for participants if they have the right coverage and whatnot. But yeah, it's very expensive. You know, the psilocybin sessions themselves they're basically a full day. You know, I mean they're 6 hours, but you can't cram two into a day. They're kind of exhausting often. So you know, people have to charge for a full day's work. You know, to one person usually. I mean, groups is a way to help lower the cost, but and that's where my research was in doing group to try to encourage that model, which is beneficial beyond just the cost effectiveness. It's also therapeutically beneficial, but it's a tough sell to participants. People don't want to do group stuff usually. Um, so yeah, the sessions can cost anywhere from, like $1,500 on the low end, including preparation and integration, but to anywhere, people are charging like 3,000 or and more in some cases for those. So there's a big barrier there. A large portion of people participating in the program are wealthier folks flying in from out of state or
Pearl,
even from other countries to
place,
so not a
Pearl,
lot of
place.
locals, just looking for therapy because of that price tag. So,
Okay.
um, yeah, we're hoping to address that issue. That's kind of the area of my research, actually. But did that answer your question at all?
Totally. Yeah. And especially at like those kind of price points, it's definitely not going to be something where they can easily do repeated therapies as needed for
Right.
most. Yeah.
Yeah. So most people do one or maybe two.
Do
Yeah.
you find, because you worked with both the CAP and this, like, do you find this to be a more transformative like experience or like longer lasting? Because I know like with CAP, sometimes the issue is like you'll have kind of wear off or like they'll go back in and need more. Like, have you noticed a difference with that?
Yeah, this is a really common question that I get with people who come to me because I have perspective on both, and they're always trying to figure out which one is going to be better. And I don't have a good answer for that. Like usually what helps guide people in making a decision is that the ketamine is a little bit gentler of an experience, and because it's a shorter experience, we need to do multiple sessions so people can kind of like spread it out a little bit. Whereas the psilocybin is, one or a few bigger experiences, and it's a bit more activating. So for like someone who has trauma, they might prefer a slower, gentler approach, which you can do with ketamine, over a potentially really activating psilocybin experience. But I can't really say, I mean, there's not really any head-to-head research to answer that question. So all we have is anecdote. But my anecdote is that there's not necessarily a huge difference between psilocybin or ketamine. What most people think of ketamine, where most of the research is with the infusion model, which treats it just like a drug. And so we have to also think about really comparing ketamine assisted therapy, which is a form of psychedelic therapy, really. And in that way, it's very similar. The only difference being the number of sessions and the length of those sessions.
Sure. Okay, yeah, that's cool because that's like where it's harder from pharmacists. Obviously, with like Schedule One, we don't have a lot of access to data and information like that. So I'm always curious about that. Obviously, we're limited in what we can recommend, but it's useful to kind of know like the parameters for this, especially like because I am involved a lot in CAP. So it's interesting to hear like that side of it. And I knew you had experience in research and more than just, that specific psychedelic kind of aspect to it. So yeah, that's cool.
Yeah.
I
Any
was going to
other?
ask the same thing. The comparison, like, why would you choose ketamine over psilocybin? So next time you're going to have to do a ketamine presentation for us to give us more information on that. I also have to say, like, when you came to me, God, years ago, right, about the psilocybin program, and one of the things I didn't like was that you couldn't act as your doctor self, right? In like, I understand not during the experience, right? Because that's a whole different skill set and whatnot have you. But it bothered me that when you're having these intakes, like you should be able to use all of your tools to make the assessments. And so that was the one thing that really didn't sit well with me. So I'm glad that they actually corrected that because um I think, I would rather have an experience with a when I know I'm with a doctor, even though the experience part is not that hat, but at the same time, like that I've had a conversation with a doctor before I do this rather than, someone who I mean, just someone who was not in the medical field and just went in this direction, which I know that they have value in that way too, because I know part of this whole thing is it's supposed to be an experience, not medicinal, right? But it does make me feel better that you're not constrained, especially in that intake portion, and then in the integration portion, from being able to be your doctor self. So I'm pleased that they changed that.
Yeah, it's
I
definitely
didn't
an
even think about
improvement.
the insurance piece, but for sure, just I think from a care perspective, I would rather you be able to be an ND in those roles than not.
For sure.
Well, that was super helpful. Does anyone else have any questions? Um, yeah, when it was the legislative session last year, I kept running into who's the guy from OHA that was, anyways, he kept like, we're getting close, we're getting close. I'm like, okay. Like I would see him and in the halls as they were going through the legislative session. So I know that they
Mm.
worked really hard to get some of those changes passed.
Uh-huh.
So cool. Okay. Thank you, Dr. Hicks. That was really helpful.
Yeah, you're welcome.
Um, okay, so the last item, um, thank you, Woody. The last item that I have, I just wanted, because you're an advisory body to the board. I just want you to know that the board's budget is like it's not great. It's incredibly tight. And we are working we had to raise licensure fees and other fees to try to make up the stopgap. Basically, we're by law, we're supposed to have 6 months of reserve at the end of each biennium. We weren't even going to have any reserve at this point for the end of this biennium, and very little for the next. So we had to raise fees in the special session. Um, And even still, because we had to raise fees in the special session, the majority of our license fees comes in October, November, and December. So by when the new licensure fees went into effect on January 1, we lost the bulk of our of the bang for your buck, basically, from raising the licensure fees for this year. So things are incredibly tight. And we are, having to have all of our meetings on Zoom now. We can't do them in person, which I think is really unfortunate because I think board meetings in person are really important to have a really robust conversation and deliberation around investigations and discipline. Not that we can't do it over Zoom. I just feel like there's tremendous value to that. So that's the last thing I wanted to cut other than staff. Um, but I was forced to do that. And so, we are looking, by law, if you are a qualified member, you get stipends. And a qualified member, I think you make under $50,000 as an individual. Thank God, a leaf blower every day. Anyways, so under $50,000 as an individual, under $100,000 as a joint filer. When that happens and you get the full stipend rate, that's set by statute. If you're a not qualified member, generally we don't have to pay you. I think that that's not right, but I just wanted everybody to be aware that the stipends that you're going to get are not what you're going to see in the statute, which would be like $180. We're going to do half of that because it's a half a day. It's $60. And then the board gets, even though they put in a tremendous amount of work before the meeting, reviewing hundreds and hundreds of pages of investigations and medical records, they're going to only get a day stipend too. So it's unfortunate. I feel like the things that we should be able to value, right? People's hard work and energy and commitment and dedication, um, and our, main mission, right? To make sure that we have accountable naturopaths and the highest quality of care standards. I mean, those are the things that have to we have to go inward on, but inflation and costs of just doing business in the state skyrocketed last year, well beyond what we projected. We projected like an 11% to 15% increase. Um, just our administrative services costs went up 39% instead of 15%, right? We had our licensure database people went bankrupt. And so now we have to find a new licensure database or their reconfigured licensure database program. And that's going to double, right? And so when you're a small board, um, the smallest of increases can just put you over. And so these ginormous increases really is why we had to go to get emergency action. So I'm literally cutting, like I'm to the point where because we work remotely, like I'm at the point where I'm like, we can save $50 if I turn off my desk phone and we turn off Doug's desk phone. Like we're literally looking for pennies in the couch at this point. And so we're just doing the best. I think I will say I'm concerned. I'm concerned for all of the small boards, and I've made this clear in public meetings with the board, and I've made this clear in meetings with the governor. I've made this clear for the legislature, so it's fine that I'm saying it again on a recording. It's just like if there is a commitment from the governor's office and the legislature, if there is a commitment to making sure that we continue to have small boards, right? The legislature loves that we go and talk to them about what we're working on and what's affecting people in their district. Like they want to hear us. So if there's a commitment to have these small boards continue to be autonomous, right? I mean, direct reports to the governor and being able to be, one-on-one with the legislature and not an umbrella board like a lot of other states, they're going to need to do something about a sliding scale for payments, cap on, what fees can be raised on smaller board. Like it's just not sustainable to put all of this increase that's completely out of our control on the backs of 1,250 licensees. So I keep banging that drum as much as I can. I'm, cutting as much as I can, but it is grim. So on that cheeriness, does anyone have any questions? And we're not the only ones, right? Like the amount that, especially the database and the Department of Administrative Services costs going up like 39%. It was insane. It really took a lot of boards out, and a lot of boards either raised fees before in the last legislative session, or there was one other that did it with me in the special session. And for sure in the next session, there's going to be a lot more. So it's not just the naturopathic board, but I will say we are one of the smallest, right? Like the occupational therapy board has 3,000 licensees. The speech pathology board has 4,000 licensees, right? So when you have that number of licensees with that kind of income stream, you can kind of adjust. We have 1,250, right? And so it makes it more difficult. And I don't I don't know why. I have some theories, but occupational therapy, we were in a meeting yesterday. They have 5 complaints a year. We have like 50 in a good, like we have 50 investigations in like a good year, right? And I mean good year is in not a ton. And so we have to have a full-time investigator, right? We have to have these resources in order to just function. So that's where we are. It's, it is what it is, but um, just thought I would share that lovely news with you. And then, I really so changing gears a little. So we had this meeting yesterday about budget and to introduce a legislative concept, meaning like you're asking the governor to approve it, and it goes to become a bill, just like the old Schoolhouse Rock. We have to do anything that's just it has to be neutral, like it can't cost us money. but I think that, this board is really valuable. I think we need to keep it, but I think that it's kind of evolved past what the statute says it is. And so I'm really thankful for your all's input on how to do that. Like I really like the direction that like we're talking about now with Dr. Hicks and like kind of looking at this more than just the ones that are on the formulary. And I think having this advanced practice provider kind of be how it evolves too. I think that that's really helpful because I think that we really do need to see. I think that the way that this council can be effective is seeing how medications and drugs affect patients and populations, and then that could be the advice to the board that I think is better than like where we had been when I started. Like, should we be allowed to? I mean, and I know this was important, Dr. Hicks. I'm not trying to Timothy Chalamet you too, but like we had how many conversations about the difference between sublingual and IV ketamine. Like that lasted forever. And I look back on that now and I'm like, why did that last forever? But like that's just the time and where we were stuck in, right? And so now I feel like it's changed so quickly that I want us to continue to have membership and agendas that actually matter to the patients in the population. So I really appreciate that feedback from you all.
Is there anything we can do to help like with the budget? Because I know you can like waive stipends and things too, right? We have that
Yeah,
option for that this year.
you can. You did.
I did, and
I
then
don't know if I was supposed to just sell you out. Like, well, whatever.
there was a whole thing that happened, and then they threatened me. And anyway, so I'm happy to do that. I just
Yeah.
don't. Yeah.
Yeah, you can. It's up to you. When I complain about budgets, I want to make sure that people understand that I believe that people should be paid for what they're worth. I'm just really limited
Oh, for
in what
sure.
I
I'm
can.
not
Yeah.
saying people need
Yeah.
to, but like
No,
we
I know.
have that
I'm just,
option,
yeah,
right?
you
Yeah.
do. Yeah. I'm just
Okay.
kind of in a weird spot of I can't, right?
Oh,
Even
yeah,
though, even
for
though,
sure.
even though by statute, I really don't have to pay anyone who's not qualified. I just think that that's wrong, but I have to do it in a very limited way.
Fair.
I
Yeah.
think I'll speak up. I feel like the frustrating part for on the board, because we've had these same discussions, is like cutting the stipends in half or getting rid of the stipends is like a drop in the bucket. Like the expenses are so high, the requirements for paying like PERS, government employee, like all these things. And so that's where it feels sort of futile with these changes. And I am not super optimistic. I think that our number, like the schools are outputting fewer licensees. People with the changes in CE, I have a dozen of colleagues who are like, we're no longer keeping our organ license. The CE is challenging. There's more states that often offer licensure because previously Oregon was like one of the only ones, or there's so people would keep if they're in licensed state would keep an Oregon licensure. So I think that I don't think it's financially sustainable. I don't know what the solution is, but these little things of us like giving away our stipend or not collecting it, they help. I don't want to say but it's drop in the bucket.
Yeah, I mean, I seriously, like, I literally canceled my desk phone and Doug's desk, or investigator's desk phone to save 49.98 a month. I mean, because everything, the costs are completely, like, the majority of the costs and the price increases are completely out of my control. But yet, I am responsible for the bottom line. So I do have to find the $50 here and the $17 there, and that is where we're at. And I agree with you. It's a very it's difficult to see a path where this is sustainable because there's just at some point there's going to be no more phone lines to cut, right? Like we've done all that we can. Now, I definitely disagree with the CE thing because other states have way worse CE hours.
Well, no, I mean, I know that I've heard of people say they dropped because, or they had multiple licenses and they were sticking with whatever made most sense for them.
Yeah.
But the CE, that's a complaint I've heard.
Well, we can discuss that at the board meeting because that scratches my sunburn, as my sister says.
Yeah, but I don't think it's not going to turn things around. It's not like suddenly
No,
people flock to like renew their license because the CE requirement is
right,
a little bit less.
right. Yeah, so no, I'm just being the bearer of bad news. I really don't know if there's anything you can do to help. I just I just want to keep you just The public doing the public's business wanted to be transparent on that.
Yeah. I know the Board of Pharmacy had to raise all their fees by 40%. So
Yep.
you're not alone in it for sure.
Yep. The medical board just raised theirs, I think either just a smidge more than us or a smidge less than us. We had to do 28%. And so they either did 30 or 26. I mean, they were just in the same window as we were.
Yeah.
All of them do. Apparently there's no shortage of lawyers because my fees haven't raised in years. So I don't know what's going on there. Um, but the one thing that everybody can do is try to find a medical board person. We have been out without a medical board person for a really long time. So a licensed from the like, and I wish I would have so psychiatrists, if that's like that would work, right? So that would be helpful.
I've been shot down very hard by everyone I've asked.
I know.
They're not.
Nobody wants to be
They're
on
just so
another.
busy. Honestly, like I think it's the same thing, right? Like in the medical fields, everyone's feeling very stretched thin. Budgets are very tight. I think everyone's having to do more to make less. And so I think
Mhm.
just another commitment is a lot for everybody. But
Yep.
yeah, that's kind of been the consistent response I've gotten.
Yep.
It's tricky. Yeah.
Anything else? Well, I'd like to thank Adam for your years and years and years and years of service. I think that you've been here almost as long as I've been here. Like, did you start in like 2018, 19, something like
I
that?
started actually one year before you.
You
I
were
think
1 year before me?
Natalie just was the only person was there when I joined.
Oh my gosh.
Yeah.
You were here a year before me? Wow.
I know you've been on this for a long time. It'll be weird to not have you on it.
Yeah.
Yeah.
You need to be
Was
paroled. You're free.
remember
You're a
like
free man.
yep.
What are you
Was
gonna do with all
pleasure
your
really
spare time?
was pleasure working with all of you, and it was a very nice journey. I really enjoyed it. I wish you the best of luck for everyone, and I hope, situation's gonna financially at least get better.
Yeah. Well, wow. I appreciate that. I feel even kind of guilty that I made you stay on like a whole extra year. I thought you were, I didn't realize you predated me. But thank you. Yes, we really appreciate you hanging in there and on all of your input and thank you so much.
It's my pleasure. My pleasure.
Anything else?
I know we need to talk about the next meeting date, and I have a conflict on the 16th of September, so I was wondering if we could be open to discussion on date for the next meeting.
Did you just say you too, Stephanie?
I said, let me look.
Oh,
I am in DC doing for compounding, like talking with people. So that's either the day I'm on the hill or the day I'm flying. I don't know. I think I'm on the hill that day. So that's it's virtually impossible for me to do this if we do. And that's totally fine if I need to miss it. I just thought I'd mention.
stop it. Sorry. Cat.
I'm
Let
available
me up.
the week before or the week after. So no conflicts.
On the Wednesday.
Mhm.
Yeah, 9th or 23rd is totally fine, or 30th. Any of that's fine. I just literally it's the only one. It's a big issue.
They know they need to be fed soon. Stop it. Okay. I'm good that either the week before or the week after. Does anyone have another conflict that they know of? I can send out a doodle poll too if this is too far, like if this is too difficult to do on a Zoom meeting.
I'm fine either way.
So am I.
Oh, okay, great. So let's do which one well, Natalie, would you prefer to do it after you're in DC or before? I think we should do it after, right? Because then you can tell us about your
Yeah.
That's
That
what I'm
makes,
thinking.
yeah, that's fair. Yeah, because it's a whole update on like all the different stuff that's happened federally and state. So, and then I'll
yeah.
meet with people. Yeah, that makes sense to me.
Let's
That
do it on the
works.
20, let's do it on the 23rd then.
Okay. Thank you. Sorry about that.
No, that's
I
fine.
liked when they
And
posted the dates, I was like, oh no. I was like, of course.
and I'll send out a meeting invite for that just so we like I'm gonna do it right when we get off the phone or get off the Zoom so we all remember.
Perfect. Thank you, everyone. I appreciate it. Thanks for your flexibility.
Well, that actually will be good because then you can be our star speaker.
Oh, how exciting. I know. All right. Sounds
Okay.
good. Well, and then I don't think we have any public comment or public people on the meeting, right? So
Nope.
do we have to approve the meeting minutes from the previous one? I just realized we didn't do that this time.
Because I didn't write them.
Ah, well, easy. Done. We'll worry
Now
about
that
it later.
right, and now that we have, well, I can administratively approve them and keep a record of them. But I will do them and we'll approve them. I'll do them for this and approve them later, but it's fine.
Great. Makes our lives easier. All right.
Yes.
Well, Adam, you will be missed. Thank you again so much.
Thank you
It'll
very
be so,
much.
I
Thank
know
you
it's
very
so
much.
weird. We've been on this for so long together. So
Yes.
Yes.
good
Yes.
luck with all of teaching and all your good stuff that you're doing, all your good
Thank you
work.
very much.
Yeah.
Thank you.
And welcome again to Matthew and welcome John for your second meeting. Nice to
Thank
have you.
you.
All right, everyone. Do we have to vote to adjourn? I can't remember. Do we, or can we just
I
adjourn?
think we can just say it's 10:50 and we're adjourning.
Great. Sounds great. Thanks, everyone. See you in September.
Thank
All right.
you.
Bye.
Bye.
Thank you. Bye.
Healthy, be safe.